Hey guys, so in this video I wanted to respond to a comment that was left on a recent video of mine. The video that I am referring to is the one where I was talking about the ban on ectopic pregnancy terminations and my opinions on it as someone who has dealt with miscarriages and ectopic pregnancies in the past. And so the reason why I wanted to address this comment is because I felt that the comment was very judgmental. But I do think that her opinion deserves to be heard. So this person had a lot to say because I said that I would never judge someone who is choosing to have an abortion. And obviously she is very anti-abortion based on her response. I don't know if this comment is actually visible on my channel or not because I did respond to it, but when I go to the video, it doesn't show up. So I don't know if you guys even were able to see this after she posted it. But like I said, I did respond to it, and it had to do, like at the end, her comment said that she was very disappointed that people like me were getting into healthcare or wanted to get into the healthcare field. So for those of you who don't know, if you've never seen my videos before, I am currently in pre-med, a pre-med program with the goal to eventually become a doctor, obviously. And I had said that I feel like a woman should be able to choose if she wants to have an abortion or not. I do not agree with banning abortion strictly from the viewpoint of a woman knows her situation better than I could. I have never had an abortion unless you count the removal of my ectopic pregnancy as an abortion, which technically it is an abortion procedure, but the reason I had to have it is because an ectopic pregnancy is never viable. It's not something that I wanted. I was very excited that day when I found out that I was pregnant, and then a few hours later, they were telling me that it was an ectopic pregnancy and it had to be surgically removed. So if you count that as an abortion procedure, then I guess it is. But I have never electively had an abortion. I don't necessarily agree with abortion personally. I don't think it's something that I could ever go through. But as a future healthcare practitioner, provider, I would never judge a patient of mine because, like I said, they know their situation better than me. They know what they are capable of. They know if they're able to care for a child. I do understand this person's viewpoint. Like I said, everyone is entitled to their own opinion. I don't want anybody to judge or, send hate to this person because of what she said. But my goal as a healthcare provider will always be to be that advocate for my patients and for what they feel is right for them. Will I always agree with it? No, because like I said, everybody's entitled to their own opinions. I'm not always going to agree with everything that every single one of my patients has to say or thinks is the best choice for them. But as a healthcare provider, I have to respect their decisions. I have to respect that they think they know or they do know what is right for them. The thing about medicine is that people have the right to refuse. They have the right to do something, even if you don't agree with them. I don't think that that makes me a bad healthcare provider. I don't think that that makes me a bad person. I think, my viewpoints are or how I want to be as a healthcare provider is that I want people to feel like they're able to come to me in a situation and not feel judged. I don't plan on going into like OB-GYN. I don't plan on having that be my specialty. I'm leaning towards neurology or psychology, psychiatry. As you guys very well know from videos that I have posted previously. But regardless, even with psychiatry or psychology, after an abortion, a lot of people have to seek therapy because they feel guilty about their choices or they feel horrible that they had to have an abortion because, it is a baby that they are not choosing to allow into their life or choosing not to go down that route. I'm sorry if how I'm explaining this is a little bit offensive to people who may have had an abortion. That is not my intention. I'm trying to think of the right word so that it's not offensive. But, you know, I don't want people to feel like they can't come to me if that's what they had to do with their life. I want people to feel welcome. I want people of all different cultures, all different religions to feel like they can come to me, and that I am not going to be someone who's going to hate on them for their skin color or their religious choices, or, you know, like whatever they choose to do with their bodies medically. And this person also had commented that it's not a woman's body. It's not a woman's right to choose because the baby has no choice. I do understand that some people believe that, but I am not a person, you know, like it's kind of in the situation where if, let's say the woman had cancer and she just found out she was pregnant after she, you know, was diagnosed with cancer, do you really think that a woman, you know, she could either choose to die potentially, because if you don't have certain treatments during cancer, you could very well die, depending on what sort of cancer you have. If you have to have chemotherapy and radiation, what is that doing to a child if you choose to have these treatments while you're pregnant? And I don't really know of doctors that do that while you're pregnant. I don't know that that's a thing. If it is, please correct me. But, you know, regardless, everybody has their own situations in life, and I don't feel like I'm equipped to judge anyone. I've made mistakes. I've done a lot of things that other people disagree with. And, you know, I've done things that I'm not proud of myself. I've said a lot of stupid shit. You know, I've done stupid things, but I don't want people to feel like they can't come to me, especially if I'm planning to be a psychiatrist. How would that feel to people, you know, if I'm just judgmental and not welcoming whatsoever? Like I said, I don't mean to put you down. I don't mean any hate towards you. I have no ill will towards you whatsoever, but I will always advocate for what is best for my patients. And I will always advocate for my patients to be able to make choices when it comes to their body and their care. And that was the wood in the fireplace behind me. I will always advocate for them, and I will always encourage them to make those choices for themselves, like I said. So let me know your thoughts. Do you think that it's bad as a healthcare provider or a future healthcare provider to say that, you know, a woman should be able to choose? Do you think I'm wrong in this situation? Do you agree with the person who commented? And like I said, I don't know if you guys can even see her comment. I did respond to it. I didn't delete it. I allowed it to post to my channel. But I'm not going to say her name. I'm not going to post the comment on this video screen or anything like that. I felt like it needed to be addressed. I don't think that there is room for bias anywhere in healthcare. I don't feel that there's room for judgment anywhere in healthcare. I feel like we should be open and welcoming and non-judgmental with all of our patients. So let me know what you think. If there's any other topics you'd like me to talk about on my channel, please feel free to let me know, and I will get something filmed for you. And with that being said, I will talk to you guys next time.